Now for cholesterol-lowering agents, ending in statin or vastatin, like atorvastatin, simvastatin, lovastatin, or even rosuvastatin. So we think S in statin, think S for stay clean, keeping those blood vessels clean and clear from cholesterol. Or think statins kind of sound like smooth tin can with a stat tin. Now caution, the Nclex will try and trick you with a sound-alike drug. So it's not niacin. That's used to treat oral candida. So think nistatins are for nasty yeast infections, and vastatin are for the blood vessels. Now the mechanism of action is quite simple. It prevents cholesterol production in the liver by preventing an enzyme that is needed to make cholesterol. Now the key point here, guys, write this down. It lowers the bad cholesterol and increases the good. So bad cholesterol is total cholesterol, triglycerides, and the LDLs, the loser lipids. All should be low except the good HDL cholesterols, the happy lipids. Guys, those are the only ones that should be high, over 40. So just think H for HDL, H for high. Now they're given to patients with high cholesterol, aka hypercholesterolemia or hyperlipidemia. Just different names for the same thing. Now the key points for the exams are side effects. It's both liver toxic and has muscle pain properties. So to help you, we made the acronym STAT for statin. S for sore muscles. Keywords are muscle cramps, muscle spasms, and muscle aches. So guys, teach patients to report these muscle pains, these cramps or spasms to the HCP. Now ATI had a question about this, when to notify the HCP, and the answer was muscle aches and cramps. And even Kaplan said report new muscle tenderness to the HCP. And also Hesse reporting muscle pain and tenderness without injury. Suspected rosuvastatin. Now guys, it's possible that this could be rhabdomyolysis, basically a rapid breakdown of muscle. So a big test tip here, we monitor the creatinine. Anything over 1.3 means bad kidney, since muscle breakdown can clog the kidneys as they try to filter the blood, usually a sign of that rhabdo. Now T is for toxic liver, so we monitor the liver labs every year. ALT and AST, normally between 10 and 4D. Now guys, avoid any patients with liver problems. So no alcoholics and no hepatitis or cirrhosis patients. Now A is for avoid grapefruit. Guys, not even grapefruit juice. This was mentioned in ATI as well. And a little side note from the Hesse. Never mix with St. John's wort. Now, typically St. John's wort's bad for everything on the Nclex. So don't mix it with statins and not even SSRIs, which are an antidepressant. Now T, we take at night. The key term here is take at dinner time or bedtime, since the liver comes alive at night to produce cholesterol. Alright guys, that wraps it up for our cholesterol lowering drugs.